Good morning, everyone, and welcome to our clinical case study presentation. My name is Sarah.
And my name is Reese, and here we're going to discuss a clinical case about abdominal aortic aneurysm, which is a life-threatening vascular condition. Here we have a patient history when it's about David Kingston, which is a 72-year-old male who presented to the emergency department. He was referring complaints about lower back abdominal pain for the past 48 hours. But in the morning, his pain got severe. He also referred a pulsating mass in the abdomen.
His medical history is significant for hypertension, hyperlipidemia, and a 50-year smoking history. He denies trauma or recent surgery. No fever, but he reports dizziness and has had one syncopal episode at home. His blood type, which is type O positive, we also consider due to the awareness of that kind of blood.
Now, when we talk about the physical examination of the patient, we examine blood pressure, heart rate, and abdominal examination. In the blood pressure, we discovered that he had 88/56 millimeters of mercury, which indicates that he had hypotension. And in the heart rate, we discovered that he had 112 beats per minute, which indicates tachycardia. And in the abdominal examination, we found that effectively he had a palpable pulsative abdominal mass. In the auscultation, we found that he had broods and the peripheral pulses were totally diminished.
At this point, we'd like to open the floor for discussion. Based on the patient clinical presentation, what would be your leading diagnosis? Our leading diagnosis is a leaking abdominal aortic aneurysm. Let's explain why we reached that conclusion.
Okay, to understand abdominal aortic aneurysm, we first have to understand the profile of the patient. Here the patient was an elderly person, in this case a 72-year-old man, and also presents chronic diseases. In this case was hyperlipidemia and hypertension. And also he had a very long smoking history. All these four things constitute the main four risk factors to develop abdominal aortic aneurysm.
On physical examination, he was hypotensive and tachycardic, with a palpable pulsatil mass in the abdomen and a brood on auscultation. Those are classic signs of an abdominal aortic aneurysm, and the hypotension suggests it might be leaking or rupturing. Now, look at the symptom pattern. He came in with sudden, sharp abdominal pain that followed vague discomfort for 2 days straight, and he also mentioned a visible pulsating abdominal mass, which is a key red flag. Additionally, he experienced dizziness and a syncopal episode, which point to possible internal bleeding and a decreased perfusion, which is a vascular emergency.
Now, when we come about the complementary diagnostic methods, we go to the laboratory and the imagery diagnostics. In the laboratory diagnostics, first in the blood count panel, we found that the hemoglobin levels were below the normal, 10.2 grams per deciliter, which means that there can be a possible internal bleeding. And now, when it comes about the white blood cell count, we found that there was 13,000 per cubic millimeter, which means that there is a possible inflammatory process due to stress. And now, in the coagulation panel, here both aspects were normal in the international normalization ratio and in the active partial time. And here in the arterial blood cast show up, here we have that the hydrogen power or pH was below normal, 7.30, and in the levels of bicarbonate were 18 millimoles per liter, and the lactate levels were higher than normal, 3.5 moles per liter. And the high lactate levels, they can indicate hypoperfusion. And in the urine analysis, here we mentioned that he has microscopic hematuria, which can indicate hypoperfusion in the kidneys. And here in the imagery, we've made an angiography, and the angiography revealed that he had a 6.8 centimeter of diameter inframental abdominal aortic aneurysm, with clear signs of leakage and retroperitoneal hematoma, which means that this aneurysm is a clear surgical emergency.
Based on the complementary diagnostic methods, we did a management and our working diagnosis is a leaking infrarenal abdominal aortic aneurysm with signs of impending rupture. We called vascular surgery right away. The patient was stabilized with IV fluids and got 2 units of packed red blood cells. He was taken to surgery for endovascular aneurysm repair, or what we also call EVAR. And the package of red blood cells were based on his blood type, which is type O. After it, we talked to our patient and we tried to make him understood that the factors that were risking these kinds of illness were reversible. Some of them, for example, to stop smoking, and it was an indication to make it right immediately, and also to make him stay on a healthy diet, and also to do a little bit more of exercise. And we also try to optimize the treatment of hypertension, hyperlipidemia, and diabetes. In his case, he had hypertension and hyperlipidemia. After surgery, he stayed in the ICU for monitoring. We gave him antibiotics due to possible contamination or any infection risk. And also his blood pressure was controlled with labetalol, and we started aspirin and statins once he was stable with the treatment. The aspirin was taken to antiplatelet, and the statin was for the lipid control. In summary, this is a 72-year-old man with a leaking abdominal aortic aneurysm, and the key signs that we took in account were abdominal pain, hypotension, and a pulsatile mass.
This case shows us that quick diagnosis and quick surgery saved this patient's life. Here, summarize the risk factors were the age, smoking, hypolipidemia, and hypertension. This case highlights how early diagnosis and early surgery can make a difference in saving these people's lives when we talk about this type of vascular conditions and emergencies. Always suspect of abdominal aortic aneurysm in elderly people who has a long smoking history and also have hypertension and hypolipidemia. And with that, thank you for listening, and we're happy to take any questions now.